Warning: this video was created for educational purpose. The main goal is to provide scientific and public health related information in an understandable, easily digestible manner, with a portion of humor. Might contain disturbing disease-related images and information. Hello and welcome. In today's video we will talk about Ebola virus disease. But before we dive right into it, let's start with a couple of definitions. Firstly, hemorrhage. Hemorrhage means to undergo heavy or uncontrollable bleeding. And secondly, hypovolemic shock, which results from hemorrhage. Hypovolemic shock is an emergency condition in which severe blood or other fluid loss makes the heart unable to pump enough blood to the body. This type of shock can cause many organs to stop working. That was it, and now let's go. Ebola virus disease, in brief EVD, also known as Ebola hemorrhagic fever, initially emerged over 40 years ago in the Democratic Republic of Congo, formerly known as Zaire. This virus belongs to the family of Filoviridae. As the name itself says, it possesses a filamentous shape, which might be surprising to some, including me, having an ongoing pandemic in which the virus has a globular shape. It all started in 1976. An individual from a rural area in Sudan worked in a factory in the township of Nzara, presented with complaints of headache, chest pain and fever. The patient developed bleeding from the nose, from the mouth and bloody diarrhea the next day. After infecting several of his colleagues and family members, the patient died on July 6th, 4 days after his admission to the hospital. Endemic to Africa, 36 outbreaks have been reported in 6 African countries since the initial detection of virus in 1976. The largest outbreak to date has been reported between the years 2013 and 2016 in West Africa, notably in Guinea, Sierra Leone and Liberia. Most recent outbreaks were recorded in a remote area in the provinces of Equateur and the North Kivu in the Democratic Republic of Congo in May and June 2018 respectively. And now let's dive into some detail. Fruit bats belonging to the Pteropodidae family are believed to be the natural hosts of Ebola viruses, with humans and other mammals serving as accidental hosts. The Ebola virus virion is a single-stranded, non-segmented, negative-sense RNA, meaning it is an RNA-based virus, that is approximately 19,000 nucleotides long, consisting of, pay attention, 7 genes and 9 proteins. Unlike most of the viral infections, Ebola virus has high pathogenicity with debilitating complications and fatal outcome. This pathogenicity is primarily related to its structure, as Ebola virus is a lipid-enveloped virus that aids the virus into entering human cells. But the main question remains, how does this virus act once in your body? It starts by disrupting the immune system of its host. It suppresses the maturation of dendritic cells, which are part of our immune system, which leads to disruption in the production of inflammatory cytokines that impairs their ability to activate T cells, which is the other part of our immune system. Furthermore, it suppresses the activation of T cells. It also blocks the transcription of our body-owned antiviral genes. Subsequently, it upregulates the tumor necrosis factor alpha production, inducing viral damage to the surrounding tissue. Tumor necrosis factor alpha is typically elevated in a series of disorders, including inflammation. And finally, this leads to increased activation of coagulation cascade, causing damage to the vascular integrity and permeability. This damage in the vessels may lead to hypovolemic shock, and subsequently disseminated intravascular coagulation plays a huge role in the mortalities associated with Ebola hemorrhagic fever. Transmission of the Ebola virus has been reported in various ways, including human-to-human transmission through close contact with blood and bodily fluids such as saliva, breast milk, urine and semen from another infected human or animal, either by direct contact or indirectly from contaminated objects like needles and syringes. Interestingly, it is not spread through aerosol droplets or by water and food contamination. Furthermore, humans can get infected with Ebola virus via contact with wild animals in situations such as hunting and preparing meat from infected animals. Notably, high levels of viral RNA in amniotic fluid, which is the fluid surrounding a growing fetus in pregnant women, infected with Ebola virus disease were shown to highly affect placenta and fetus right after delivery. These factors, along with elevated in utero fetal and neonatal fatality rates, are strong indicators of vertical transmission of Ebola virus disease. And I think you can guess by now, vertical transmission is simply from a mother to the baby. Clinical manifestations. The incubation period ranges from 2 to 21 days. Disease is usually diagnosed based on multiple virologic consequences such as sudden onset of illness, high fevers above 38 degrees Celsius or above 101 degrees Fahrenheit for less than 3 weeks, at least 2 hemorrhagic symptoms such as bleeding from the nose, from the mouth, bloody stools, and despite no predisposing factors for hemorrhagic manifestations, generally provides ample evidence to the clinicians to consider Ebola hemorrhagic fever and begin supportive treatment until confirmation of the virus is provided by the laboratory findings. These include serologic testing for the Ebola viral antibodies, the real-time polymerase chain reaction (RT-PCR) for clinical blood and oral swab specimens, as well as immunohistochemistry on a skin biopsy. However, these latter two techniques are most used to diagnose post-mortem Ebola virus disease in people who died before hospitalization. And finally, the antigen tests are implemented as well. It is important to say that handling any Ebola virus disease patient-related specimens and samples requires facilities with a biosafety level 4 due to the following definition of Ebola virus. Category A bioterrorism pathogen with a significant transmission probability throughout the nation. Management and treatment. Management of patients suffering from Ebola virus disease involves supportive care such as maintaining fluid along with electrolyte balance, blood pressure and oxygen saturation. This also includes treating complications arising from secondary infections. Anti-Ebola virus vaccine efforts have been in progress for the past 2 decades, culminating in over 12 different vaccine candidates that have been placed into several clinical trials. However, it was not until December 19, 2019, when finally the United States Food and Drug Administration (FDA) approved the Ebola vaccine RSV-ZEBOV. The RSV-ZEBOV vaccine is a single-dose injection and is a live attenuated vaccine that has been genetically engineered to contain a protein from the Zaire Ebola virus. The Phase 3 clinical trial study reported promising results providing significant protection against Ebola virus-mediated disease. Public awareness in order to gain the public support is essential to limit the spread of the disease. Various strategies like contact tracing, burial practices, quarantine, restriction of the movements have the potential to curtail an outbreak. However, resistance from the community is a significant hindrance to the implementation of these strategies, primarily because of the people's perception regarding their social and cultural values being violated. In conclusion, frequent outbreaks of Ebola virus disease have caused numerous mortalities and morbidities. Since the virus may lead to a pandemic, its prevention has become of utmost importance as it is highly capable of causing significant physical and economic burden.